All right, when we went to break, our new HHS secretary is making some comments. Let's listen in.
Announced the termination of USAID. My uncle started USAID in 1961 for humanitarian purposes, to put our country on the side of the poor. It has been captured by the military-industrial complex. It has become a sinister propagator of totalitarianism and war across the globe. And very few people understand how sinister this agency really is. And President Trump saw that, and he stood up to it with a masterstroke. And we want to do the same thing with the institutions that are stealing the health of our children. We need a revolutionary figure, and you are that figure, and I'm very grateful for you for giving me this opportunity. I want to recognize some of the allies that I've had in this battle for a long time: Senator Rand Paul, Senator Ron Johnson, Senator Roger Marshall, Marjorie Taylor Greene, and Buddy Carter, who've all been champions of the MAHA agenda before I even came along. I'm very grateful for you for standing strong. Thank you very much, President Trump.
Secretary of Health and Human Services, Robert F. Kennedy Jr. Mr. Secretary, thank you so much for joining us. Great to see you.
Thank you for having me.
Before we get into the priorities on day one, you talked about prayer today in the Oval Office with all of those paintings from Reagan to Andrew Jackson to Abraham Lincoln, Washington, all around you. Why did you go to that moment?
Well, you know, I think it's relevant because we're not just in a health crisis, but we're in a spiritual crisis, and those things are connected. And you know, so many times during my campaign, traveling across the country, I sense that people are feeling disconnected. We have a whole generation of kids that feels alienated, dispossessed. They are in a existential crisis, not only because their health is, you know, 77% of our kids can't qualify for military service. There's a purposelessness in their lives, and no sense of usefulness or effectiveness or connectedness to their communities. And that drives also the chronic disease epidemic and the epidemics we're seeing of depression, of suicide, of alcoholism, of drug addiction. I think we have to address all of those things at the same time. We can't just say we're going to make you physically healthy. We have to.
That's a tall order.
Yeah, well, I think, you know, we all have to learn that, you know, we need to get up in the morning and not think about what am I going to do to make myself happy today. We have to get up and say, what am I going to do to make myself useful today, to be useful to my friends, to my family, to my community. And that paradoxically is ultimately the path to happiness, that connectiveness that you get from doing, you know, from doing good things, from being of service to others.
And you're in what I was reading so much about today, and we're going to get to the, you know, the usual criticism, but the addiction community responded to your confirmation today by saying this gives hope to those who themselves have struggled at one point in their lives with either drug addiction or alcohol addiction. Not only can you turn things around, but you can move to a totally different plane of accomplishment and spirituality. That was a big message to the people out there, millions, to this moment, who are struggling. Speak to that.
And I think it's the same thing as, you know, most addicts like myself feel like, I feel like I was born an addict. And that you know, that these impulses are biologically hardwired into us. And whether you feel that way or you feel you became an addict or an alcoholic later on in life, the only way to overcome that biological impulse is with a spiritual realignment, a spiritual fire. And so I think, you know, and that comes from connectiveness to community. And, you know, alcoholism and addiction are a disease of isolation. People end up in jails, institutions, and dead or in bathrooms by themselves, or insulated by secrets. But they withdraw from the community and from connectiveness. And the process of getting sober is a process of reconnecting to community.
Well, minutes before your confirmation vote, there was someone who wasn't too happy. Watch.
Previous HHS secretaries have had a pharmaceutical industry background, have been a state health commissioner, have run health systems, have been governors. Somebody who has had a background in actually administering the programs that HHS administers. Which of these qualifications does RFK possess? You know the answer. None of them.
I mean, at the top, he just gave away the ghost, referencing, you didn't work for the pharmaceutical companies. How dare you? So he said the quiet part out loud there.
The qualifications that Senator Schumer is talking about there are the very qualifications that got us to where we are today. These are the people who got us to be the sickest country in the world. We are 4.2% of the world's population. We buy 70% of the pharmaceutical drugs on Earth. We spend 2 to 3 times what other countries pay for health care, and we have the worst health outcomes. We literally have the sickest population in the world. Those are the people that got us there. We do need a break. We need somebody different who can come in and say, I'm going to be a disruptor. I'm not going to let the food industry and the pharmaceutical industry run health policy anymore. We're going to turn health policy over to people who are actually concerned with public health.
Are all drug company grants going to be done away with anyone on an advisory board or anyone who's connected to the federal government?
The panelists in HHS, in FDA, CDC, and NIH, there are panels that are made up of outside individuals, outside experts, who come in and set policies. They set, for example, the food triangle, the food pyramid, the nutrition guidelines, the vaccine guidelines, the medical standards of care. In the past, those people, almost all of them, have severe conflicts of interest. Oh, and that's not good for our country. And we've seen what's happened. You have Fruit Loops at the top of the food pyramid.
What's the top 3 additives that you hope in your role you'll be able to basically remove from our food supply?
Well, I would say, first of all, I believe in freedom of choice. If you want to eat Twinkies, you ought to be able to eat them. But you ought to know what's in them. So a lot of what I'm going to do is about radical transparency, about making people understand, allowing people to understand, and empower them with an understanding that if you eat that, it may seem cheap, but it's going to cost you in the long run. You're going to get diabetes, et cetera. There are certain additives. We have 10,000 additives in our food. The Europeans have 400. Many of the additives that we have are just illegal in Europe.
All right, a lot of news happening, as it is every day. And moments ago, Robert F. Kennedy Jr. was sworn in as the new Health and Human Services Secretary, as President Trump creating the Make America Healthy Again Commission to investigate the root causes of America's health crisis, starting with chronic childhood diseases, including autism. Here is some of the reaction from senators after RFK Jr.'s confirmation.
We've got to get into the business of making America healthy again.
By now, it's beyond clear that Mr. Kennedy is not remotely qualified to become the next secretary of HHS.
I think that his emphasis on youth obesity and food health, processed foods and ultra-processed foods, it needs a look. And it's a passion of his.
What do you make of the fact that your Republicans have largely unified around many of Trump's noms, especially RFK?
No backbone. They need to grow a spine. Mitch McConnell ought to be an exhilarating role model for them.
So given all that, the pluses and minuses from the senators, he passed with every vote on the Republican side except for Mitch McConnell. Let's bring in Nicole Shanahan, RFK Jr.'s former running mate during his presidential campaign. Nicole, it's great to have you with us. You posted a video about the long road that you have been on throughout the course of this as his running mate. And, you know, it's not lost on anyone that a Kennedy of the famous Kennedy Democrat family, you're a former Democrat yourself, is now joining the Republican Trump administration. Your thoughts on the significance of today?
I mean, out of breath. It's been a big journey. It's been a big journey for so many of us to get to this moment where we can actually look under the hood of chronic disease in the United States. Mothers, thank you, all of you. This is we're cheering today. We are cheering. We are getting together. We are talking. We have hope for the first time in a really long time. And there's definitely a big battle in front of us. There's been so much money put into the campaign against RFK, even this past week. Tens of thousands of dollars presented to media influencers to just get final hits out against him. And you know what? Just in spite of all of that money that's been spent to stop our movement, we are unstoppable. And I'm so happy we're here in this moment today.
Nicole, it's an enormous agency, and we're going to scroll everything that will be under his purview. He has an enormous job ahead of him. $2.4 trillion in spending. It's 25% of the United States budget. We have seen what has happened with the cabinet members who have been approved. Pam Bondi, Scott Bessent. I mean, these people are hitting the ground running in such an enormous way. So, and I know that you've mentioned that you plan to be in an advisory capacity to Bobby Kennedy as Secretary of HHS. So tell us what that will look like. How will he hit the ground running? What are the first orders of business for him?
He's really going to look at it holistically. And I think that's really important to get across a lot of lies have been spread about how he is going to undertake this position. Do not believe those lies. This is a very carefully assembled group of people around him with task force that have some of the best doctors, scientists, that will be advising every aspect and every important decision coming down the pike. Those going into NIH, the CDC, the FDA, these individuals are the top of their field, and they're not bought out by big pharma. And that's the number one goal right now, is to make sure that anyone who touches this budget, anyone who touches taxpayer dollars that go into news media and that go into different programs, different scientific areas of research, that it's not being informed by for-profit corporatist interests. It's being informed by people who genuinely deeply care about the holistic experience of children, that really care to make sure that they get the best possible interventions early on.
Well, Nicole, I know that
they're not being held hostage.
You have led a very forceful group of passionate moms, and you're one of them. Let's listen in to this ceremony. It's happening right now.
Take this obligation freely.
I take this obligation freely.
Without any mental reservation.
Without any mental reservation.
Or purpose of evasion.
Or purpose of evasion.
And that I will well and faithfully discharge.
And that I will well and faithfully discharge.
The duties of the office.
The duties of the office.
On which I am about to enter.
On which I'm about to enter.
So help me God.
So help me God.
Congratulations, Mr. Secretary.
Quite something to watch that. Bobby Kennedy Jr. in the Oval Office, where his uncle served as president, where his father served as the Attorney General under President Kennedy, and he was there with Cheryl Hines, his wife, and some of his children in the Oval Office. So there's another one to check off. It has been extraordinary, actually. I think there are 19 cabinet members who've been approved now, which is double the pace of what we saw the last time around. So John Thune, as majority leader, has been moving this ball very quickly through the course of the Senate and these confirmations. It's been quite something to watch.
RFK Jr. confirmed as HHS Secretary today, and the healthcare industry has stayed actually very quiet. Politico had an interesting piece on this. It said, quote, they haven't spoken up, even though he has accused of them of fraud and conspiracy and promised to hold them accountable. That's not because they aren't worried, but because they didn't think they could stop him, or they think the cost of speaking out would be too steep. By staying mum, they hope to limit the fallout if Kennedy follows through on his plans to strip the industry to the studs. Brownstone Institute founder Jeffrey Tucker joins me now to discuss. Jeffrey, always great to see you. What do you make of the silence from Big Pharma on RFK?
What we're dealing with is a mass movement that is basically furious about what happened in the COVID years when they shut the churches, shut the schools, shut the businesses, made us stay home, restricted our travel, said we couldn't have weddings and funerals, and couldn't visit grandma in her home. That was a level of intrusion on American liberty. And why did it happen? Well, we found out in time. They had a special shot for us, and that shot came. They mandated it for us. It didn't perform the way they promised. And what you saw birthed out of that COVID experience over the last 5 years is mass incredulity and really a kind of fury and a curiosity. What is really going on beneath the surface here, and why did all this happen to us? So RFK's confirmation today represents, I would say, the ultimate repudiation of 5 years of what I would call basically hell. And so it's very invigorating and very exciting. I think the healthcare establishment knows this. Big Pharma knows this. They have to deal with it now. This is the new reality.
It's fascinating, Jeffrey, because we would have assumed there's huge lobby dollars going on in the background, senators being bought off to vote against RFK. We just didn't see that. And by the way, Politico went on to say this is why. The muted response is also a reflection of how much President Donald Trump has sacrificed traditional GOP constituencies to raise a populist working class revolt on the interests that once held sway in the Capitol. So not only does Big Pharma not want to be on the wrong side of this movement, but senators. It's a movement. It's not simply an R&D trading of the White House and trading of D.C. It's a true movement, and I think that leaves everybody, industries and senators, going, I don't think it's wise to be on the wrong side of this movement.
Well, this is very exciting, I think, for everybody, because we're seeing the ways in which public opinion is actually working as a feedback loop to what our politicians are doing and what the government is doing, which is, by the way the founders set the system up. I mean, they had confidence that you could have some kind of back and forth relationship between the people and the system under which they live. A lot of us have wondered if that's really true for a long time, but we're seeing it happen now, and it's enormously encouraging and gratifying to see this work, to see democracy actually work the way our founders imagined it might.
Jeffrey, you're one of the smartest guys I know, but you're not the first person I've heard say that. I've heard it inside my own home, that this moment is empowering. It makes it feel like your voice matters as you see these things change. Now, as smart as you are, Jeffrey, I'm sorry, I'm going to have to dumb it down for just a moment, okay? I have to present to you some of the rebuttals to Elon Musk and Doge from the left. Enjoy.
So not only are we going to stop the privatization of public education, we are not going to let them to destroy the Department of Education. Department of Educations provide funding for 26 million kids who are living in high poverty areas all over this country. And we have the radical idea that maybe poor kids deserve the same quality education that rich kids do. That we're not going to turn our back on the black and the brown and Latino kids. That we're going to stand up for every kid in this country. Because we know that without a strong educational system, our democracy is going to be in trouble and our economy is going to be in trouble.
What I think is really important, and what the American public want, is for us to bring actual weapons to this bar fight. This is an actual fight for democracy, for the future of this country, and it's important to push back on the chairperson of this committee.
Jeffrey, I asked for those two back to back, and I'm going to tell you why. First of all, that is astounding to hear from Congressman Garcia. Bring actual weapons. They set the standard that that's violent rhetoric, and now they meet their own standard with a president who's twice had an assassination attempt. Bring actual weapons. But I asked for Bernie as well because Bernie is making an outdated argument, and what has been exposed about Bernie as he votes against RFK or whoever it may be, he's no different than Garcia.
Yeah, my sense of that moment when he was outed as a big pharma shill, that it was as important in our generation as the Hiss Chambers trials were in the 1950s. It was a shocking moment because this is the anti-corporate crusader who turns out, it's like Scooby-Doo episode. You pull off the mask and there's the mayor. And there's Bernie, shilling for big pharma. It was a shocking moment, and God bless RFK for doing that. It's very strange to me to have all these people basically defending an old order that everybody knows has completely failed. It's defunct. It's expensive.
Right.
There's no transparency. There's no normal accounting standards that every corporation would have. That's all that Musk is doing right now, is bringing normal standards of transparency and accounting to government, which, Will, I'm sure you saw this, but 4 days ago, 5 former secretaries of Treasury wrote in the New York Times that no elected politician or their appointees has had access to the federal books since 1946. I don't know if did you see that?
No, I didn't.
I mean,
and
even
that's
for me,
stunning.
That is shocking. And they were bragging about this and said this is the way it should continue. All we're asking for
ridiculous.
is a normal standards of accounting that you would get from any public corporation or any nonprofit for that matter, or even the smallest convenience store down the street. You have to have accounting. The federal government doesn't have it.
I got to leave it here, Jeffrey. I like your point about the status quo, fighting so hard to preserve the status quo. And that includes, by the way, education. To offer rebuttal to Bernie Sanders, how's that education been going for black and brown kids for the past half century that you want to preserve? How's it going? About like everything else in the status quo. Jeffrey Tucker, always smart, always makes us more educated when we get done listening to him, despite his bow tie and the Kodiak in his pocket that I know is sitting right there. Jeffrey, I'll see you next time.
We are awaiting Robert F. Kennedy Jr. to be sworn in as Health and Human Services Secretary. He was one of President Trump's most controversial picks. Now he is set to make major overhauls in one of the largest departments, tackling what critics call America's health epidemic. Let's bring in Dr. Mark Siegel, senior medical contributor. And how would you describe this day for you? What changes will he or impact will he have, Dr. Siegel?
Sandra, he's a disruptor and he's a reformer. And one of the things that he's identified is our obesity epidemic, which is 45% of American adults, which is outrageous. And even more shocking, perhaps 20% of children. And I can tell you as a practicing internist, it leads to disease. It leads directly to heart disease. It leads to diabetes. It leads to strokes. It leads to sleep apnea. It leads to cancer. And if we can prevent all of that before it happens by getting control of our weight and exercising more and changing what we eat, we're going to cost a lot less money. It'll be a healthcare system again rather than a sick care system. That's number one on his hit list. Number two, probably equally as important, is to look for bloat in these various agencies. What's all the money going for? Over $1 trillion. What is it being spent on? What's excess? What's actually useful in terms of research, in terms of intervention? And the third thing, also equally as important, what about public confidence in our healthcare agencies? Took a big hit during the pandemic. Remember the mandates. Remember, we know it's our way or the highway. The word misinformation. All of that took a big hit. So Kennedy will be focusing more on transparency, on safety. Is it effective? Isn't it effective? What will work? What won't? He's going to be taking on big food and big pharma, no doubt. And again, background as a reformer, this is in keeping, Sandra, with what President Trump is doing in general, which is trying to get things changed in the direction of what's best for Americans.
Okay, so we had Leo Biasucci on our program on Monday talking about the RFK movement, and specifically he was addressing food dyes, something a lot of people are talking about. Doctor, listen.
These companies need to do better. They really do. I mean, when we know now, I can't blame my parents. I can't blame previous generations because we just didn't know. Now we know. I mean, imagine if we found out lead was in our pipes and we said, you know what, we're just not going to worry about it.
Yeah.
Let's do something about this. And it's an exciting time. Let's make this happen.
All right, he's an Arizona state rep who's been leading this charge. He feels very passionately about it. Will we see changes like that, like food dyes taken out of our grocery stores?
There's no doubt about it. By the way, I would disagree with him on one thing. We did know. We took red dye number 3 out of cosmetics, which you put on your skin back in 1990. Why did it take 25 years to suddenly get it out of food? And one more thing, microplastics, we're finding out that. We are just finding out. It's in our brains, it's in our hearts. I talked to one of our top cardiologists in the country, and he said, and he's not alone, he's worried about inflammation in the hearts leading to heart disease from the microplastics. And a lot of it is in ultra-processed foods, which Kennedy's talking about. So we got to get our food cleaner. It's got to be healthier. It's got to lead to less obesity. It's got to be farm to fork again. And that takes a lot of changes. Farmers may benefit from that in the end, but we need a healthier diet and a healthier lifestyle.
All right, Dr. Siegel, thank you so much for joining us. Something a lot of people are talking about, and we'll see when that happens shortly. RFK Jr. to be sworn in as the HHS Secretary. Thank you very much.